Welcome to the MS&Me Radio Network, a division of the Multiple Sclerosis Global Support Network. The following program broadcast is an original creation by the broadcast entity. Discussion within the following broadcast should be used for informational purposes only and is not a substitute for professional medical advice or consultation. Before considering application of any broadcast content in the following program, please consult your healthcare provider. If you feel you are having a medical emergency, please contact your local health services for immediate assistance. MS&Me Media and the Multiple Sclerosis Global Support Network do not guarantee or warrant the accuracy of information in the broadcast to follow. The Multiple Sclerosis Global Support Network provisions broadcast services to program hosts. Information discussed in the broadcast does not necessarily reflect the views, opinions, or goals of the network and are solely those of the show broadcast host. Should you wish to host a broadcast, please visit our website at msmemedia.com and submit a request to become a program host. We thank you for listening to the MS&Me Radio Network. Enjoy the show.
Hello everyone and welcome to Chronically Well Club on MS&Me Radio. This is your host Rebecca Naylor coming to you today from Toronto, Ontario, Canada. And in this broadcast, I'm going to continue, as I talked about last week, to talk about the 8 keys of what I consider to be very, very important things about our lifestyle and the way we live our lives, which can really help us to find ultimate health. For me, I was diagnosed with MS back in 1997 and have, with a lot of hard work, which has since become easy work, I have managed to stay in remission. I have not had a relapse since about 1998. So pretty much 20 years since my diagnosis, 19 years since my last relapse. So if you're looking for an overview of my 8 keys, I would invite you to go back and listen to my very first episode, episode 1, which is called The 8 Keys. I am a professional educator here in Toronto. I've been working as a high school teacher for the past this is my 15th year coming up. And I also have an organization I created called Chronically Well Club, which I have created in order to share everything that I've learned about working with MS and healing from MS with the MS community. So as a health coach, I create online videos and was lucky enough to connect with MS&Me and be offered this radio show. So I'm super excited for today's episode, episode 2, the current healthcare system. So I really want the first episodes that I record as part of this radio broadcast to give you a clear idea of who I am, what I'm about, how I can hopefully help you, and what my real philosophy is about healing and what we can do to become our best version of ourselves, really discover our power to heal. So I want to talk about really the current state of our healthcare system. Now, I am coming to you from Canada. I was myself born in the UK, but I came here when I was a baby, so I've spent pretty much my whole life in Canada. We are very, very lucky here to have what is known as universal healthcare, which basically means, to a lot of people, free healthcare. Everyone has a card from the government, and if you're feeling sick for any reason and you want to go see a doctor, you don't pay a penny. You go to your family doctor, you go to a walk-in clinic, you go to a hospital. It doesn't matter if you're just getting a prescription for a painkiller or a major brain surgery, you don't pay a penny. So that's awesome. However, there are a lot of drawbacks to that system, which I have become really, really acutely aware of since being first diagnosed with a chronic illness. Because chronic illness is very different than an acute illness or an emergency, an accident. And I've experienced both. I've been in a car accident. I've had, sudden onset things where I have required immediate care. And in those situations, I'm very, very thankful for our current healthcare system. However, when it comes to managing things like chronic illness, our healthcare system right now in Canada, and to the best of my understanding, in many places elsewhere around the world, is really, really lacking. So let's talk about why that is. In my opinion, it comes right down to the medical schools, the medical institutes that train our doctors. So first of all, I want to put a shout out to doctors. Doctors are awesome people. I love them. The majority of them, I have found, went into healthcare and healing because they wanted to do just that. They wanted to heal. They wanted to help people. I've met very few doctors in my life that I felt were in it for the money. You'd have to be kind of crazy to do it for the money, because the lifestyle that goes along with it, my goodness, some of the doctors I know are the unhealthiest people I've ever met because of the hours they work and the stress they deal with. It's quite crazy. Especially those that are coming into the world now, really, really overworked, high stress environment, right? So they really only go into that because they want to help people. However, when they go to medical school, they're basically taught how to recognize symptoms, categorize them, by ticking off check marks in a box and coming up with a diagnosis. That is basically the goal of our modern healthcare system. Figure out symptoms, give a diagnosis. Success, right? And it almost feels like, to a lot of doctors, giving the diagnosis is what they consider to be success. But it's like, hey, I thought success was me getting better, right? Not giving a name to the random series of symptoms that I'm experiencing. So then when doctors do give us a diagnosis, what happens after that? Well, generally, a couple things will happen. Either they'll refer us to someone who specializes in this, this named thing which they have given to us, or they will prescribe a drug, or they'll recommend surgery, which is basically cutting out a part of our body. So those are kind of the limits of the tools that are available to people trained in our traditional medical system. Prescribe a drug, recommend a surgery. When it comes to wellness and prevention and maintaining health, there's really very little that doctors are prepared to do. And I use the word prepared very specifically because it is about preparation and training. A few years ago, a friend went through medical school and just graduated, became a general surgeon. And I remember asking him casually one day, so how much time did you spend in medical school on nutrition? And he told me that it was one lecture. One optional lecture. So despite the fact that they take a Hippocratic oath, and Hippocrates himself, the doctor of doctors, like 2,000 years ago, said, let food be thy medicine and medicine be thy food, still, doctors learn nothing about nutrition. And that's just one of the lifestyle areas that is so, so important, not just for healing, but also for prevention. So knowing this, you really have to become your own advocate. So this is what this radio show is really about. It's about recognizing that this is the state of our healthcare system today, realizing that there's not a lot that can be done for people with chronic illness within the current healthcare paradigm. And so how do you become your own advocate? How do you step up and take action and take responsibility for getting what you need from that system and then going elsewhere away from that system when you're not getting what it is that you need? So there's a really awesome trend happening, which I consider myself a big part of, and that is a move towards patient-centered care and what's known as lifestyle medicine. And it's all those things that doctors don't have time to work with you on because they really are just too busy prescribing drugs and recommending surgery. So it's time to take back our power. For a long time, doctors have sort of been on a pedestal. And think about that saying, just what the doctor ordered. What the doctor ordered, right? So that was always how the doctor-patient relationship was seen in recent history, right? The doctor is the expert. The doctor has the answers. You as patient do not have the answers. The doctor gives an order, and your job as a patient is to follow orders. This is really changing. And let's be real, a big part of this is because of the internet. And the internet is an amazing thing which allows us to communicate, it allows us to advocate, it allows us to learn and collect information and share. It can also allow us to drive ourselves crazy with contradictory information and also mostly negative information. Because let's be real, when people are happy, they very rarely go online and leave positive reviews. But when people are upset, when people do not feel that they have been served, they are very, very quick to get online and give a bad review. So anything that you come across on the internet is going to be very heavily tainted towards the negative. So please keep that in mind anytime you're looking for information on MS or support for MS on the internet. Just be a very wary consumer of that information. And also know when to stop, right? The internet at this point is virtually unlimited. There's so much information out there. And one of the things that is causing stress for a lot of people, including we MSers, is information overload, right? I saw a statistic a couple of years ago that said something like the average human being today in a single issue of the New York Times gets more information than a person 100 years ago would in their entire lifetime. Think about it, right? We're just bombarded by information. This is a total tangent, but it's one of the reasons why I actually choose not to watch the news. I don't watch the news. I don't listen to the news. I do not read the newspaper. Because really, 99% of the stuff in there is not relevant to my life. 99.9% of the stuff in there is really, really negative and stress-inducing. If something is important enough and relevant enough to my life, I'm going to hear about it through word of mouth. And this has served me well for years now. It has been a long time since I have read a traditional newspaper. So anyway, all that to say, be wary of the internet. It can be an awesome resource. In fact, you're probably listening to this broadcast on the internet. So yeah, it's awesome. Just be a really conscious consumer and make sure you're really thinking, where is this information coming from? Do I trust this source? And is this information that I'm getting helping me to uplift me to become the best version of myself? Or is it instilling in me fear? Because as I will talk about on a regular basis, fear is the number one enemy of everyone, really, not just those of us with multiple sclerosis. So let's go back to this idea of lifestyle medicine. Lifestyle medicine respects you as the person who knows your body best. How many times have you ever been in the doctor's office and you say, look, I know this is what I feel. I know this is what's going on. And the doctor's like, yeah, I don't think so. I've been in medical school and this is what I think. And it's very, very invalidating. I once had an experience when I was in my mid-20s when I had to go to the hospital with what turned out to be paroxysmal spasms, which some of you may have before. They're triggered by hyperventilating, and they're quite painful tremors in my arms that caused me to clench up my fists. And when I went to the hospital, I was told by numerous doctors over the course of 13 hours that basically I was having a panic attack. Now, I know what a panic attack feels like. I have actually had one before, and this was definitely not a panic attack. Anyway, eventually I got working with a neurologist who very clearly knew exactly what I was talking about and gave that emergency doctor a piece of their mind. But it was very, very invalidating. And that was one of the things that really motivated me to myself become more of a self-advocate, but to also help other people become more of a self-advocate. You know your body better than anybody else. Your intuition is almost always right. That's why when you do multiple choice quizzes, people always say go with your first instinct. Because anytime you second guess yourself, you usually regret it, right? So stop, listen to your body, and don't let anybody else tell you that they know your body better than you do. So there are many, many areas of lifestyle medicine that are within your control. And again, I outline these areas in episode 1 of Chronically Well Club, the 8 keys. But a brief recap of the 8 areas that I think are very important. They are your diet, your toxins, your movement, your environment, your emotions, your cognition, which also includes your creativity, your gut, and your mindset. So within these 8 areas, I really encourage you, like I have done for the past 20 years, to become an explorer, become a scientist, try new things, pay attention to cause and effect relationships, have fun tracking things. I mean, it may not be fun for everybody, but me, I don't know if it's because I'm a Virgo, but I like to track things. If I'm trying something new, I like to do a food journal or do an exercise chart or some way of tracking how changes are manifesting in my life, right? So as you try new things, as you get new ideas, you don't have to do the really structured kind of testing that a traditional scientist does, but really think about, what is a scientist? A scientist is someone who comes up with a hypothesis, right? A hypothesis being an idea that they think is true, a theory. And then they go out conducting some kind of an experiment to see whether or not their intuition, their hunch, their hypothesis is correct, at least for them. Now, when it comes to making hypotheses, about yourself and about your health, you are the best scientist there is. So, as you come across new ideas, start to be a scientist in your own life. Try them out, pay attention, track your responses, and figure out what works for you. Because the reality is, there is no one answer of what works for everyone. And if I were to summarize my entire philosophy, I would basically say, listen to your body and get out of your own way, because your body knows how to heal when we just get out of its way. Bodies are amazing. Bodies are awesome. They do so much without our awareness in terms of our immunity and our healing, everything from a paper cut to a virus. We don't even have to think about it. But a lot of things we do get in the way of that healing. So, as you're working with your doctor, one of the important things that I encourage everyone to remember is that along with healing comes choice and responsibility. And this can be, no pun intended, a bit of a hard pill to swallow sometimes, for people to recognize that everything in their life is a choice. And for everything in their life that they respond to, all of their actions and all of their behaviors, no one is responsible for your actions other than, you guessed it, you. Now, in no way am I saying you are to blame for your illness or any of your circumstances, right? This is just about having an awareness that our choices have consequences. People ask me sometimes, how I stay fit and slim. And it's not about, one perfect meal. Your diet is an accumulation of tiny, tiny choices that are taken many, many times. And everything is like that. Your health in general is an accumulation of many, many choices for which you are responsible. When you look at cause and effect, I heard it said by someone recently that between a stimulus and a response, which is the same as cause and effect, there is a space. And in that space is your choice. I'll say that again. There's a stimulus, something that happens in your life, and a response, that's your choice and your behavior. And between the stimulus and your response, you have this choice, right? You get to choose how you're going to react. We don't create our circumstances, but we always get to choose how we react. Now, that's a big part of taking responsibility for our health. And it's something very, very important if we're going to move to a more patient-centered healthcare model. You must recognize your own responsibility in this new paradigm, right? So working with the healthcare system, as I said, you need to be your own advocate. So what is an advocate? It's somebody who stands up and communicates what they need. It's very simple. It's a simple idea that a surprisingly small number of us actually engage in. As I mentioned last episode, I'm a high school teacher and I specialize in special education. So I work with students who are often very disadvantaged, who have many different kinds of disabilities, from learning disabilities to physical disabilities to cognitive and health disabilities, right? And my main strategy in working with these students is to teach them to become their own advocate, especially at a high school age where they're going to be going on to independent living soon, and they're not going to have a mom or a dad or a teacher to do this for them. Becoming your own advocate is not something that is part of our public healthcare system all the time. Our education system all the time. Not everyone is taught how to do this, so sometimes you really need to break it down. Being an advocate means telling your doctor what you need. It means walking in to any doctor's appointment with a plan. What are the questions that you have? What are the symptoms you're experiencing, which you would like some advice on how to manage? So remember, it's not the doctor's orders, it's the doctor's opinion and the doctor's advice, which you may or may not choose to follow. And you really have to refuse not to be listened to. This is kind of the definition of being assertive. Communication is a big passion of mine, and I work with a lot of groups, both as a health coach and a teacher, in teaching really strong communication skills. Assertive, what does it mean to be assertive? Assertive is kind of a middle ground between being passive and being aggressive. To be passive means to kind of let people walk all over you, to not speak up, to not communicate, to give in easily, to stay quiet. To be aggressive, most of us know what that means, right? It means to come on too strong, to be demanding, to communicate in a negative way that is not constructive, okay? That tends to escalate the situation. To be assertive is in the middle, and to be assertive is a really good place. You're not being aggressive, but you're not being passive either. You're calmly and very clearly communicating your needs, and you are staying true to your needs until they are met. It's very, very important. I first learned about this in the most explicit way when I studied something called nonviolent communication, and it's a system developed by a guy called Marshall Rosenberg. And I came across Marshall Rosenberg's nonviolent communication, almost about 10 years ago now, when I was at a teacher's professional development session. And there were about 5 sessions offered, and I looked at nonviolent communication and I thought, I don't need this. I'm not a violent communicator. But it ended up being the only workshop with space, and so I went and it totally changed my life. It's a really terrible title for an awesome communication system, which basically teaches you that when you want something, to get what you need, you almost always get what you need if you approach it like this. It's like a fill-in-the-blank template. You say, when this happens, I feel this, because I have a need for this. Would you be willing to do this? It's that simple. So let me give you an example. I used to have a doctor that, thought it was a good thing to multitask. And the whole time I would be there in the appointment, they would be typing on their computer. I don't know if they were typing notes about me or if they were writing a letter to their mom. I don't know, but they were always typing. So I had to say to the doctor, excuse me, when you type on your computer while I am sharing my concerns, I feel frustrated because I find the sound of typing very distracting. I have a need to clearly communicate my needs, and I also have a need to feel that I am heard. Would you be willing to wait until we are finished talking before beginning to type? When I did that, the doctor just stopped and looked at me and said, I'm so sorry. Absolutely, absolutely. I would be happy to give you the space that you need so that we can communicate. Now, why is this system so effective? And you don't have to do it so robotically as I just did it there. Obviously, there's some give and take, and you can make the style your own. But it's so effective because there's no blame. It's not saying, you are doing this, which automatically puts people in the defensive, right? You're simply communicating your feelings. You're communicating what you're observing. You're communicating what you need, and you're asking for help. Now, all human beings have an innate, that means built-in, tendency to want to help other people. Just watch kids in the playground, right? They always want to help. In a classroom, when the teacher says, who wants to take the attendance down? Me, right? We naturally want to help. So when you ask somebody to help you have your needs met, rather than blaming them for not meeting your needs, the response is so positive. So this is a strategy you can really use when communicating with your doctors. Another suggestion I have with doctors is to always ask why. If they're recommending something for you, ask them why they're recommending it. Ask them for evidence, ask for research, and also ask who sponsored the research. That can be an important thing as well. And ask for alternatives and different options. Getting a second opinion is okay. Getting a third opinion is okay, because these are just opinions and options. If a doctor is unable to explain why they are recommending a certain thing, for example, I had a neurologist recently, when I asked her if she knew anything about diet or what diet she would recommend for MS, she said, oh, a low-fat diet. And I said, why would you recommend that? And she said, I have no idea. I think I heard it a few decades ago. Now, that's actually the absolute opposite of the current recommendations for MS diet, which is high fat. So there's just an example of where it's really good to ask why doctors are recommending things, because it's often just habit, and they often don't even know why they're doing it, because they're just so stressed for time. They're not bad people. Again, they're just so stressed for time. So as you are collecting information, you're collecting information from doctors, from websites, from books, from other people. One of the things to watch out for is too much knowledge and not enough action. This is something I'm definitely guilty of myself. We can finish one book and go right on to the next book. Finish one website, go right on to the next website, without really taking the time to apply the things that we have learned. And then again, we're going into information overload. So really take the time to think less and do more. I have found over time that this is a really, really good mantra for me, just every day. Don't get stuck in the books, get stuck in the action, okay? Be wary of the diagnosis. It's just a name, it's just a label. Sometimes we fall into this thing called the hypnosis of the diagnosis, where we start to look at all the possible negative things, and it can really become a self-fulfilling prophecy. So try and encourage yourself and practice visualizing the best case scenario, right? Don't ask your doctor, what's the worst case scenario? Ask them, what's the best case scenario? Like when the doctor told me there's a 25% you're going to be in a wheelchair in 10 years in 1997. I said, well, there's a 75% chance I'm not. And I decided to go with that. And at my 10-year mark, I ran a marathon. So it really is your choice. All right, so you're going to stay tuned to future episodes. We're going to talk about the power of placebo. Placebo is something awesome, which really needs to be harnessed and not ignored at all. So we're coming to the conclusion of episode 2. Once again, my name is Rebecca Naylor. I'm health coach with Chronically Well Club, based out of Toronto, Canada. If you're interested in following me, you can check out facebook.com/Chronically Well Club. You can go to youtube.com/C/Chronically Well Club. And my main website is www.chronicallywell.club. I do work as a health coach with persons with MS anywhere in the world, as I use the wonderful internet as a communication tool. So if you are feeling ready to really discover your body's power to heal and have a great coach who's been there and is going to support you along the way, then feel free to check out my services on my main website. I'm also working on a book that I hope to have released to you guys as soon as possible. So tune in on MS&Me Media, where you're probably listening right now. I will be on here every week for my half-hour time slot, talking to you about all the ways that you, as a person with MS like me, can reclaim your health and start to celebrate being in remission and being your best you for the rest of your life. Yay! So that's it for me today. Create an amazing day, everyone, and be well.